how common, for somebody who is not in show business, how common are multiple cosmetic surgeries? Why would anyone want to go under the knife so many times? This is Dr. Barry Weintraub, and he is a plastic and reconstructive surgeon, and he is from New York. Is that common, doctor? Is it when somebody comes in and just picks one's nose, is it common to say, well, I'm here doing your nose, I'll do your eyes and your chin and your this and your that?
It's much more common today than it was years back. Often patients come in asking for one particular surgery. However, the goal is to get a balanced result, and you have to have a sense for facial and body aesthetics to achieve that. You must distinguish that from the plastic surgery addict, which is a different kind of person who is in some ways psychologically imbalanced, who is coming back to the plastic surgeon for numerous operations because of central and internal discontent. All of these gals are wonderful ladies who are very set and stable in their own life.
But are there people who come to you and say, more, more?
Yes, and you have to know when not to do that.
Will you tell them no?
I sure do.
No
and
more?
When I'm suspicious of it, I often invite the patient back for another consultation, perhaps a month later, and then another month later. And if I sense that it's for anything other than self-improvement, I don't proceed. Well, you must understand that every procedure that was done on the ladies here and on all my patients are discussed ahead of time, and each individual change is planned. Now, certain changes that are structural, i.e. nasal surgery, cheekbone surgery, chin implantation surgery, can really change a person's facial features to the point where they really look different. They won't and they shouldn't come out looking like another person, like a science fiction movie, but they can significantly improve the structure of their face.
But you could make somebody look completely different.
Not completely, but much improved.
So the IRS wouldn't find you?
I don't think so. That would be very hard. Women's breasts, particularly as they go into middle age, approach 50% breast tissue and 50% fat. When you're in your teens and 20s, you have much more breast tissue. That's why they're firmer and usually a little higher. As you get older, especially if you're large-chested, the fat will also accumulate under the arms. And if you just do a breast reduction and make the breast small in a lady that has a little chunkiness in the axilla or under the armpit, you'll have these pretty small breasts with these lumps of fat in the side. So you've got to kind of contour it so it looks more aesthetically pleasing.
Doctor, what can breasts weigh? I don't think anybody has ever asked that question.
A lot.
A lot.
Let me try and answer the first question in part too, and I'll answer yours. What happens is when you have a breast reduction, you lose a couple, 3 pounds, basically. But what it does is it serves as an impetus to lose more weight because you've invested this time and energy in trying to get your breasts smaller. It kind of spurs you on to really continue matters. I think that judging one's psychological stability comes with experience, and one should always remember that plastic surgery is done just for you, not for your boyfriend, not for your husband, not because a relationship is falling apart, but because of self-improvement only. And once one determines that that person is clear and honest in that way, I would then deem them stable.
Right.
First of all, understand that cosmetic surgery is not a matter of need. It's a matter of want. No one needs to have cosmetic surgery. It's something that one may want to improve themselves. And that's a decision that they make that I can try and guide them with, but I can't make that decision for them. Insurance companies are not interested in paying for cosmetic surgery. They will pay for issues that have medical justification. I'm very, very conservative, and the last thing I want is an unhappy patient. So my view is always to do a little less than too much. And that way, you always guard against discontent. So the goal and really the rule in my office is to be conservative. And that's how you chronically turn out people who are happy.